Hi, Jenna. Good morning. Kristina Bauer with the Texas Lyme Alliance.
Good morning, Kristina. So nice to see you.
Thank you. You too. A little intro about Jenna. She has served over 35 years of policy and grassroots experience in 45 countries, representing all regions throughout the world. She is recognized as uniquely qualified expert on the vital issues of transparency and accountability, human rights, and the political representation of marginalized groups. Jenna has worked with both domestically and globally to improve conditions for persons with physical and mental disabilities. Her efforts have helped to overcome obstacles to education, housing, healthcare, and food and water security for groups traditionally marginalized by cultural beliefs and/or economic practices. In 2016, Jenna initiated an international effort for persons suffering from Lyme and relapsing fever borreliosis and their human rights defenders. This resulted in meetings with the UN special rapporteurs, and the human rights violations against such persons were entered into the UN record. Jenna's leadership contributed to changing the World Health Organization's International Diagnostic Codes, ICD-11, to include an international number of potentially fatal complications from these infections. She's worked extensively with numerous groups and governments, including multiple UN agencies, nonprofits, and the corporate world, and has spearheaded many international and multidisciplinary teams. Additionally, Jenna has authored over 75 publications on her areas of expertise. We're so happy to have you today, Jenna. Thanks so much for your time.
I'm happy to be here.
Great. So we are scheduled to do 3 meetings. This first one that we wanted to record for the public today is to talk about the ACA, PTLDS, and its use and research in the Lyme disease community. So getting started today, what is the intention of the ACA and who does it protect?
Okay, I think it's very important to understand some context here.
Yeah.
Up until the mid-90s, even late 90s, chronic Lyme disease was covered through insurance treatments, insured and covered treatments.
Okay.
In 1991, the CDC website officially stated that symptoms of persisting infection may continue to recur and making additional antibiotic treatment necessary.
Okay.
They also said, and these are quotes from the CDC website, varying degrees of permanent damage to joints or the nervous system can develop in patients with late chronic Lyme disease. Okay, so, and it's so interesting because the website also talked about how nymph ticks frequently infect humans, which is something that they have dropped. They don't talk about nymph tick infection anymore. And they also talked about congenital Lyme causing stillbirth.
Okay.
So all this was part of the official language recognizing the seriousness of the disease and the need for ongoing treatment.
Great.
And then, of course, there's tons of evidence that Lyme, the infection of Lyme disease can persist. The most recent publication that came out about that was in October 2020. And this was authored by Eva Sappi, who was primary author, and multiple other authors from multiple universities and institutions helped to author it, including our own beloved Ken Legner, Dr. Ken Legner. And this publication talked about long-term persistence of Borrelia burgdorferi antigens and DNA in the tissues of a patient with Lyme disease. And they proved through various laboratories and various diagnostic techniques that, in fact, this infection was persisting throughout the body in various organ and bodily symptoms. And this was a record of the patient that Dr. Ken Legner treated many years ago, Vicki Logan.
Yeah.
So it was a very important publication because so many institutions were involved and so many diagnostic techniques were used, and proved incontrovertibly that this infection can persist after short-term antibiotics and even long-term antibiotic and antimicrobial treatment. So we used to have cover for treatment. And this is detailed quite a bit in the book called Lyme Cure Unknown, Inside the Lyme Epidemic, written by Pamela Weintraub, about how we lost covered insurance and what led to Lyme patients being covered and their treatments being covered, and the chronic, disabling, and even possibly fatal aspects of this disease being recognized by the medical establishment. She covers that in detail.
Great.
And I highly recommend that people read it to be informed and understand the situation. And then Dr. Legner also writes about this in excruciating detail in his book called In the Crucible of Chronic Lyme Disease. And there is his patient, Vicki Logan, and here he is as a younger man taking care of his patient. It's such a wonderful, beautiful photo. Anyway, this book is extremely detailed and it's over 800 pages.
Yeah, crazy big.
Yeah. And then, of course, I also wrote a simpler, streamlined version of all of this in my book called Slime.
Yeah, I have a cover right up here.
Yeah, how medical
excellent
codes
book.
mortally wound corruption and scientific fraud. But this one also gives a very good kind of
Chronological.
and chronological overview of how we lost our care.
Okay.
Now, I just wanted to mention some of the specifics because Ken Legner makes these remarks in 2013 in Union Square, New York City, at the Worldwide Lyme Rally. So he says, Vicki Logan and other patients sued Empire Blue Cross Blue Shield to cover the cost of needed care. The case was settled out of court with terms that were confidential. Whatever the settlement was, it did not include Vicki's right to be reimbursed for the cost of intravenous antibiotic therapy, which she needed. Okay. And then what happens is during the litigation, there was a deposition under oath, and Senior Vice President Richard Sanchez of the Empire Blue Cross Blue Shield stated that Empire's accountants, Deloitte and Touche, advised Empire that their review physicians needed to issue more denials of chronic Lyme to increase its profitability. So this was not a medical or scientific decision. This was a bottom line profit-driven decision to simply deny care for chronic Lyme. So this insurance company was transitioning from a non-for-profit to a for-profit entity at the time. They raised the bar to make it more difficult for patients with costly conditions such as Lyme diseases to get reimbursement for treatment.
Yeah.
So here's the VP, and his testimony said that Empire senior personnel knew that some patients who actually had Lyme disease would be denied treatment and some would suffer as a result. But they rationalized it by saying that they could always appeal their denials.
That doesn't work very well in our experience as patients.
Well, certainly not since this has become a common practice. It's became basically deny, and you wear the very sick person down until they, have run out of time and money and energy to try to fight for the care that they are actually paying for through their insurance coverage. Okay. And then he also acknowledged that some patients might be unable to negotiate he said torturous appeals process and may fall by the wayside and may sustain irreversible injury as a result. And then Empire Blue Cross and Blue Shield did transit into a for-profit entity. But the point is that there were many organizations at that time, insurance entities, that are going into this highly competitive for-profit model under the HMO changes. And there was a decision basically to try and deny any number of chronic coverage of chronic illness and cap illnesses, meaning put a limit on how much you would cover for any number of illnesses. And chronic Lyme was one of the ones that was identified. Now, what they also did was they actually hired IDSA, Infectious Diseases Doctors of America, persons who were working on the IDSA, later worked on the IDSA guidelines to deny coverage.
In 2000.
Actually in the 1990s. So they were hiring IDSA people who later became guidelines authors for Lyme treatment. And these same people were hired at the cost of, let's see, he was getting over, Dotwaller, for example, was getting over $500. Siegel was one of them in 1996. He was getting $560 an hour to review Lyme disease files and deny coverage.
And was he a medical physician?
He was one of the he was one of the IDSA people who was, writing the Lyme guidelines to deny care and being paid $560 an hour to deny care for the insurance companies who wanted to make money. What's also interesting is that around that same time, Congress was testifying and saying that, it's in congressional records that I've collected, that the average cost of treatment for chronic Lyme, I think just over $100,000. And in today's money, it would be over $154,000.
Yeah.
So there was broad recognition that Lyme was, serious. It required expensive ongoing care. It was chronic in many cases or recurring. And who was going to pay for it? And what's interesting in the congressional records is that it was the Department of Defense that stepped in immediately to do something about it because they considered it a concerning ongoing cost of all their military personnel who were possibly exposed to Lyme during the course of their field operations because of the cost of that. And also, and because it was such a debilitating illness, they were also concerned that it would affect our ability to defend ourselves. In other words, it would be such a widespread and disabling disease among the armed forces that it might be a national security threat.
Right.
So that's where we were back in the day. And then the insurance companies, with the help of IDSA, decided to basically redefine Lyme so that they did not have to cover the cost of it. But it's not just the insurance companies that wanted to, reduce the costs. As I said, the Department of Defense was very concerned about these costs, and so were many other government agencies as this was spreading and its seriousness was understood. And let me just list to you the various government agencies. All of these government agencies, because of the nature of the employment contracts, would be responsible for ongoing care of their civil service staff and any other government employee. They include United States Department of Defense, Department of Homeland Security, United States Postal Service, Department of Energy, Department of Interior, Department of State, Department of Transportation, Department of Health and Human Services, CDC, NIH, Department of Agriculture, Indian Health Service, Appalachian Regional Commission, Delaware River Basin Commission, Environmental Protection Agency, Animal and Plant Health Inspection Service, Agricultural Research Service, Foreign Agricultural Service, Forest Service, Farm Service Agency, National Institute of Food and Agriculture, Natural Resources Conservation Service, Rural Utilities Service, Bureau of Indian Affairs, Bureau of Land Management, Bureau of Safety and Environmental Enforcement, Fish and Wildlife Service, National Park Service, Office of Surface Mining Reclamation and Enforcement, Bureau of Reclamation, and United States Geological Survey.
Wow.
All of these,
that's a lot.
all of these agencies have people who have multiple staff that need to go out into the field and be exposed to environments where there are ticks. And there are even more. I mean, this is just part of the list of all the ones that have exposure.
Okay.
And in fact, there was a bulletin a warning bulletin from the Office of Health and Safety that went out to all the federal agencies back in the late 90s, talking about persistent infection, the need for ongoing care, how it needed to be treated very seriously, that it could be a chronic, persistent, and debilitating disease.
Right.
So that was all internal memos, an alert bulletin going out to all the federal agencies. So you have not only the insurance companies wanting to not cover the cost of providing covered care for Lyme, the US government's going, oh my gosh, this is going to be very expensive for us as well. So I'm just saying there's multiple actors involved in the denial of treatment. So all of these factors together contrived to deny our care for chronic Lyme and recurring Lyme infection, episodic recurral. Now, how did we regain our access to care? And that's where the ACA comes in.
Right.
Okay. So the ACA is known as the Affordable Care Act. It's also known as Obamacare. And in 2010, it was started to be formulated. And by 2012, the federal government asked all the states to submit what they consider to be a benchmark plan. Now, to just frame the ACA a little bit more, the ACA, one of the big reasons it was needed and wanted was because the insurance companies had established a very toxic practice of denying care for chronic illness and capping care for multiple illnesses.
Okay.
And so when people either lost their jobs and trying to buy a new, get new insurance, they were just basically not uninsured, and they were getting bankrupted. And the insurance companies were getting away with it for years. For years, they could just, not cover you. If you'd had cancer before, they would give you a policy that didn't cover your cancer.
That happened to me. That happened to me.
They tried to do it with me for malaria. They said, oh, well, we won't cover your blood because you've had malaria. I'm like, my blood will not be covered. So what, what the insurance, it doesn't even make any sense.
Oh,
I've never even been hospitalized for malaria. I've just been diagnosed and treated multiple times because it's everywhere in developing countries.
Right.
You can't really prevent it. You have to just, treat it, and you can take prevention, but the prevention doesn't stop the infection, and you can still get active cases. Anyway, so they made a practice of denying care, and they were also increasing the costs. They were just a runaway train. Yeah. And it had become a major crisis in this country because not only was it denying care for people, but it was bankrupting us. The average family was getting bankrupted from lack of coverage because our medical costs had just skyrocketed. So if they couldn't get insurance, then they have hundreds of thousands of dollars in bills, and they would go bankrupt. Now, it's still a problem. Bankrupting through medical costs is still a serious problem. But the ACA was basically put in place to try and make sure that all chronic diseases, that insurance companies had to cover chronic illness.
Yes.
Okay. And that they could not put a cap on an illness. So if you had a mental illness, for example, back in the day, they would cover $50,000. And then after that, you had to cover the rest of the cost. Now, if you have mental illness and you needed mental health support, they had to cover the cost without that cap. Okay. Same thing with cancer, same thing with heart disease, same thing with diabetes. So the ACA passed after quite a bit of struggle because, as you can imagine, insurance companies did not want the ACA to pass. Right. And many of our elected officials have huge contributions from insurance. And on a global scale, the most powerful industry in the world now, economically powerful industry in the world now, is insurance. It used to be big oil. It's now insurance by far. That's the most powerful industry. So they have a lot of power. They have a lot of power, particularly in countries that use private insurance plans. Okay.
And just to mention, a part of that would also be the pharmaceutical industry, correct?
Yes, and that's an interesting side. It's a more complex situation.
They go together.
They go together. They work hand in glove.
That's
they make
right.
a lot of deals. They determine what will be covered, what won't be covered. And just to give you an example, we have this thing in the United States called the CPT codes, and they determine all reimbursements, and they're tied to the international ICD codes. Guess what guess where the American Medical Association gets most of its profits from? The CPT codes. What? They own and develop the CPT codes. So the American Medical Association, which is supposed to be representing doctors, is actually a huge negotiating body between the nexus of insurance, pharma, and medical devices. And they control all the flows of money through the CPT.
It's crazy.
I mean, it is a ball of dirt. You know, it's an uncontrolled, out of control, underregulated ball of dirt that we're dealing with, or as I call it in the world of our illness, slime. Yes. Okay. So in 2012, just to go back to the Affordable Care Act. So the Affordable Care Act won. Now, it's not as good as people might want it to be, but it gained us protection for covered care for all chronic illness. And it gained us protection from having insurance companies cap us on various conditions. So all the 50 states were asked to submit what they call benchmark plans to the federal government. And this was a plan that would represent the type of care provided at that state for its citizens. So you had what they then developed called the healthcare marketplace. And you had plans that were available at the state level, but then you also had a federal marketplace where anybody could go to and say, I'm going to buy this plan. Mm-hmm. Okay, so it opened up and it kind of helped to regulate some of the basic standards of what would be cared, what would be covered. The Affordable Care Act also decided that all preventative care should be covered fully. In other words, instead of having a $50 copay to get your annual physical, you could just go and get it. Same thing for a mammogram. Okay?
Right.
All right.
Zero cost to the patient.
Yeah. Well, costs that you're already paying through your health insurance bills.
Additional costs. Yeah. Right.
Yeah. Now, some of this, I'm going to say, has been whittled away over the years because the Republican Party has been trying to destroy the ACA since it was created.
Right.
Which is, I'm going to get back to that because it's an important understanding of what's happening with Lyme patients.
Okay.
Okay. Now, so, so what happened is the Connecticut submitted for their benchmark plan, a plan from Connecticut.
Okay.
Connecticut recognized chronic Lyme. They said that Lyme, in their intake form, they basically considered it a chronic and recurring and episodic illness.
Okay.
And they recognized that it required ongoing treatment, recurring treatment, and that you could also be reinfected. And it wasn't like you got Lyme once and it went away. So the language was such that they recognized it as a chronic illness. Now, this particular one, and the ACA, the ACA made it illegal for insurance companies to have caps on a particular patient or illness and deny coverage for pre-existing conditions and chronic diseases. The ACA website makes references to specific chronic diseases and illnesses, but it's not comprehensive. There are many chronic illnesses and diseases that are not listed on the website, but they are still covered by this law. Centers for Medicare and Medicaid Services there's actually a very good record of what Connecticut submitted and was accepted by the federal government under the Affordable Care Act. And for Lyme disease, it says specifically, no limitations or restrictions on service. 2012, but the language is still standing. It says, and it's right there on the Centers for Medicare and Medicaid Services, and it's right there, and it states that this is the benchmark plan for Connecticut.
Okay.
And lower on that same page, it's like a number of pages, but on the same page where they refer to Lyme, they say no limitations or restrictions on service. And then there's a note that certain types of cancer or disabling or life-threatening chronic diseases can have access to off-label use of FDA-approved prescription drugs.
Great.
That's what it states.
Yeah, but it's not happening.
It's not happening.
It's not happening.
I think one of the reasons it's not happening is people don't know it. And people don't understand that once a plan is recognized at a federal level as a benchmark plan, that they actually have a right to cutting certain coverage. And what I did was I went back to, more recently that I was preparing for this interview with you to see if the language had changed at all regarding the Connecticut treatment for Lyme. And let me just read it to you because I think it's very, very important. Up to 30 days of intravenous antibiotic use or 60 days of oral antibiotic therapy or both. And then it also says further antibiotic treatment if it is recommended. So this matches the language that we should have basically unrestricted access to care.
Right. Determined by our physician, not an insurance company.
Exactly.
Yeah.
So we could easily get 30 days of IV, 60 days of oral, or both, 90 days, and additional as needed.
Right.
So this is still enshrined even in the specific language of Connecticut. And it is still up there on the website. So sad because I wrote about this in 2016 and I shared this information widely with the Lyme disease, the organizations that work, to help patients. And yet I don't see any mention of it in what they're speaking about, that we actually have coverage. And just to get back to Connecticut, so I went into even further detail to see where they were specifying certain things. And they talk about ongoing treatment for Lyme arthritis, Lyme carditis, myopericarditis, encephalomyelitis, meningitis, sensory and motor radiculoneuropathy or peripheral neuropathy. All of these things should be covered. Yeah. For extended antibiotic treatment. And then they say all cases of Lyme disease in pregnant women should be covered care. Yes. I mean, this is right here. And people are being deflected from this information, and this information is not being shared the way it should be. We're going to get it out now. I've devoted all my life on helping people get access to care, access to education, access to economic opportunity. So for me, this is always my focus. What are the obstacles to access? Why aren't we getting this when this is enshrined in language at the federal level? Federal law. At the state level by law. Okay, and we'll get back to that because there's a lot of reasons for it. Okay. And the other thing is they say that you can have IV course if you've just had a lab result within the last 3 months. You don't need to have a retest to get more IV or oral treatment. And they say, and you can get more if you've already had an IV treatment. And they say if the member has objective evidence of either relapse of infection.
Very common.
and progression of Lyme disease into organ damage or finding of a new focus of infection or any type of organ damage. So this is all about relapsing of, you don't have a relapse of infection unless you have a chronic infection.
Correct.
So this language is specifically recognizing the chronicity of the infection and that many people have periods of remission and periods of active infection.
Persistent.
And at times they need care, and it is covered care.
Good point, Jenna. Very nice find. And this is excellent to point these details out for people to understand that they do have protection under federal law. And
let's talk about why they're not getting the coverage that they need under protected law. Well, so one of the last points in the Connecticut document, but you'll see this everywhere, is that treatment for post-Lyme disease or post-treatment Lyme disease is not needed.
Can you repeat that, please?
Basically, it says oral antibiotics and intravenous therapy is not considered medically necessary due to insufficient evidence of therapeutic value for treatment of
PTLDS.
Correct. So they talk about post-treatment Lyme disease syndrome as a medical condition that does not require care.
Can you explain for us a little bit about what post-treatment Lyme disease syndrome is, or PTLD?
Yes, what it is it's a hocus pocus ball of baloney. I also want to mention that the ACA, the Affordable Care Act, is also rules all of the treatment options through Medicare and Medicaid. In other words, you can get it through private insurance under ACA protects this, and it's also protected care for chronic Lyme under Medicare and Medicaid.
And do you want to mention here JAN and ADA?
Yes. Yeah, and that's really interesting. So accommodation network.
Okay, very good.
Yeah. And the Job Accommodation Network is a federal website of guidance that has been put together to support the American with Disabilities Act.
Okay, ADA, yeah.
ADA. And the American with Disabilities Act is another federal law that protects us. And what's very interesting is the Job Accommodation Network recognizes Lyme, complications from Lyme, as a disability.
Very important.
So one of the things that people don't understand is they're having difficulty getting coverage for disability, short-term or long-term, when they're sick from Lyme disease. And here we have a federal agency that gives us very specific guidance on how to get and what kind of accommodations you are entitled to by law for having chronic Lyme and complications from Lyme disease. So they don't say chronic, but they say complications, from Lyme disease.
Right.
And they speak to many, many different neurological, visual, pain, etc., cognitive. And they go into detail and they talk about these all within the language of disability. And it's right there. And I actually helped somebody in California gain long-term disability using this language.
Okay.
And it's right there. It's on the federal website. Yeah. Thank you for reminding me of that. Now, I just wanted to go back to the Connecticut. So when all of this was happening, the deputy insurance commissioner for the state of Connecticut said, we might be revisiting some of these things because they're expensive costs. And she was a co-chair on the Quality Health Program. So she was actually working at the federal level to review all these plans. And what she determined was that none of these changes could be made without a change in legislation. And they decided not to change it legislatively, and they went forward. So that was a decision. And she talked specifically about Connecticut selected an HMO plan design from Connecticut as its benchmark plan. The benchmark plan provides all of the coverage mandates required by the state, which include the treatment of Lyme disease and autism spectrum disorder, which are both chronic illnesses.